Hello, I'm Dr. Mark Dailey, founder and director of the Wellness Center. If you're watching this video, you most likely have suffered with migraine headaches. I have successfully treated over 4,000 musculoskeletal cases in the last 15 years, and many of those were revolved around migraine headaches. I'm going to do two things in this short video. First is to explain what migraine headaches are. Second is to offer you a gift certificate for a complete evaluation and exam. The gift certificate is offered if you'll just fill in your email address and your first name to the right here. You'll be directed to a website that has a printable gift certificate worth $150. Now, let's talk about migraines. A migraine headache is a form of vascular headache. Migraine headache is caused by vasodilation, or enlargement of the blood vessels, that cause the release of chemicals from nerve fibers that coil around the large arteries of the brain. Enlargement of these blood vessels stretch the nerves that coil around them and cause the nerves to release chemicals. The chemicals cause inflammation, pain, and further enlargement of the artery. The increasing enlargement of the artery magnifies the pain. Migraine attacks commonly activate the sympathetic nervous system in the body. The sympathetic nervous system is often thought of as the part of the nervous system that controls primitive responses to stress and pain, the so-called fight or flight response, and this activation causes many of the symptoms associated with migraine attacks. For example, the increased sympathetic nervous activity in the intestines cause nausea, vomiting, and diarrhea. Sympathetic activity also delays emptying of the stomach into the small intestine and thereby prevents oral medications from entering the intestine and being absorbed. The impaired absorption of oral medication is a common reason for the ineffectiveness of medications taken to treat migraine headaches. The increased sympathetic activity also decreases the circulation of blood, and this leads to pallor of the skin as well as cold hands and feet. The increased sympathetic activity also contributes to the sensitivity to light and sound, as well as blurred vision. Migraines affect 28 million Americans, with females suffering more frequently, 17%, than males, which is 16%. Missed work and lost productivity from migraines create a significant public burden. Nevertheless, migraine still remains largely underdiagnosed and undertreated. Less than half the individuals with migraines are diagnosed by their doctors. Migraine is a chronic condition with recurrent attacks. Most, but not all, migraine attacks are associated with headaches. Migraine headaches usually are described as an intense throbbing or pounding that involves one temple. Sometimes the pain is located in the forehead, around the eye, or the back of the head. The pain usually is unilateral or one side of the head, although about a third of the time the pain is bilateral on both sides. The unilateral headache typically changes side from one attack to the next. In fact, unilateral headaches that always occur on the same side really should alert your physician to consider a secondary headache, for example, one that's caused by a brain tumor. And I'm not insinuating that you have one. A migraine headache usually is aggravated by daily activities like walking upstairs. Nausea, vomiting, diarrhea, facial pallor, cold hands, cold feet, and sensitivity to light and sound commonly accompany migraine headaches. As a result of this sensitivity to light and sound, migraine sufferers usually prefer to lie in a dark, quiet room during an attack. A typical attack lasts between 4 and 72 hours. For approximately 24 hours after a migraine headache, the migraine sufferer may feel drained of energy and may experience a low-grade headache along with sensitivity to light and sound. Unfortunately, some sufferers may have recurrence of the headaches during this period. Chiropractors believe that some migraines originate in the spine. Often a misalignment of the vertebra or subluxation can irritate the nerves that travel the length of the spine to the brain. This misalignment makes a person more prone to chemical imbalance in the brain. Some researchers say that realigning the vertebra, a chiropractor's specialty, relieves the pressure against inflamed nerves and can in turn relieve the headache. And I've seen this happen many, many times. As a chiropractic physician, we have been trained to diagnose the cause of the condition and treat it with the appropriate clinical treatments. Please fill out the form to the right and get your gift certificate as well as a few tips on beating migraine headaches. Thanks so much for watching, and I wish you the very best of health.